Hello students, I am Barsha, your teacher for today. I welcome you all to this online class of EVS. Today we are going to read about a very important chapter in EVS. This deals with a particular kind of insect. This insect is found almost everywhere around us, and the most important part is sometimes this insect puts us in danger. We should always take care of our health, of our body, so that we are immune towards these kind of insects and diseases which affect us. So today we are going to read about such an insect, mosquito. The chapter's name is A Treat for Mosquitoes. We have always got so many treats, birthday treats, party treats. That's a treat for our tongue, isn't it? It's so delicious when you get something very yummy and very delicious to eat. But when we do not take proper care of ourselves, of our health and our body, it becomes a treat for the mosquitoes, because the mosquitoes, they get their treat from our body, from our blood. So today we are going to study how we can avoid these mosquitoes and save ourselves from not getting affected from any kind of terrible disease. So let us start this interesting chapter today. Before I start, I should tell you, mosquitoes spread so many different kinds of diseases. Very common among them is malaria, dengue, chikungunya also. So today we are going to cover all these kinds of aspects through our chapter. The chapter starts with a very interesting conversation among the school friends, students who study in the class, and Rajat is back at school today after so many days. He was not coming to school for so many days and he had been absent for many days. Now when he enters to the school, the students, his friends, are very happy to see him and they ask, how was he? So, how are you now? Asked Aarti. I am all right, Rajat replied softly. Because he has come after such a long time, even he was very excited to meet his friends. Then Jaskirat asked, you must have played a lot while you were at home. Anybody who is at home enjoys and plays a lot. This is a natural concept of the children, that when you don't have to go to school, there is less pressure on you, there are no studies at all, and you enjoy a lot at your home. Is it true, students? You must know it better. I don't think so. Children love to go to school and they miss the school a lot. Same was there for Rajat also. Rajat replies that who wants to play when you have fever? On top of it, I had to take a bitter medicine. I even had a blood test. Rajat was not all right. Rajat was suffering from fever. And you know, when somebody suffers with fever, he or she has to take medicine. And all the medicines are not that tasty. And Rajat had to take a bitter medicine, which was not tasting good for his tongue. And apart from all this, he even had to go for a blood test. That means there was something very, very serious about him. So he had to go for a blood test. Now we will get to know what was so severe about it. Again, his good friend Jaskirat asked, a blood test? Why? It must have been very painful. The moment students we hear about blood test, we all are scared, isn't it? How will be the blood test? When somebody comes, pricks in your finger and takes the blood out of your body. Is it very nice? No. People are very much scared, but I must tell you that it is not that painful at all. It's not that painful, it's not that dangerous and severe as people think about it. It's just a simple blood test, and it's a very simple way to take the blood out of your body. There are different ways to have the blood test nowadays. There are many special machines, instruments which help to take out your blood just within a second. So it is not a complicated process anymore. And the people, those who help in the blood test, he is known as a pathologist. Their work is to take the blood from our body, from us, and to test the sample whether our blood is affected with anything serious or it is alright. So Rajat also had to go through a blood test, and he explains it to his friends that it was not that severe, it was not that painful, it didn't hurt him much. What did he say? Rajat says, actually, when the needle pricked my finger, it felt like an ant bite. It was just an ordinary ant bite. Whenever any ant bites you, it's just a prick, isn't it? So the blood test was also just like an ant bite. They took 2 to 3 drops of blood and sent it for testing. So the blood sample which was collected from Rajat's body was sent for testing whether he had any problem in the blood. And that's how we came to know that I had malaria. So it was known from his blood test that Rajat was suffering from malaria. Now that is what we are going to learn in detail. What is malaria? How was it caused? And how Rajat would have avoided this disease? Do you have any idea about it? If you have, it's very good. If you don't have, we will get to know about it just now. So Nancy asks, but you get malaria when a mosquito bites you. Nancy was curious to know that how could he get malaria, because malaria occurs when a mosquito bites you. She knows a lot about the disease. She knows that whenever a mosquito bites you, then only you can get malaria. You don't get malaria from any other way. Rajat replied, yes, but we find out by the blood test. Definitely you are correct that malaria is caused by a bite of the mosquito. But how do you detect it? How do we get to know that you have malaria? It's only when your blood is sent for testing. So Rajat's blood was sent for testing, and then only it was known that he had malaria. Now Jaskirat was more curious. She asked again, there are a lot of mosquitoes in my house these days, but I did not get malaria. What a funny part. Jaskirat tells that in his house there are a lot of mosquitoes. Then how come she has not yet got malaria? Do you think malaria is caused by any kind of mosquito? No, it's not. So, Nancy answers that who says that every mosquito bite causes malaria? Malaria spreads only by the disease carrying mosquitoes. So there is a special type of mosquito which carries the disease carrying germs, and malaria is caused by the female Anopheles mosquito. This is a particular mosquito which is responsible for carrying the germ of malaria, and they spread malaria. All other kinds of mosquitoes do not spread malaria. So there is a special type of a mosquito, that is female Anopheles mosquito, which carries the disease of malaria and they spread it. So Aarti says, all mosquitoes look the same to me. Those who do not know much about it, so for them all the mosquitoes appear the same, but it can be identified easily. The people, those who know about it, they could separate the mosquitoes because female Anopheles mosquitoes, they appear to be a bit different from the other kind of mosquitoes. So Rajat says the same thing. There must be some difference. How is it that all the mosquitoes are same? It can't be. There must be some difference, and that's what identifies them from the other mosquitoes. Okay. Now, you could see very well about the blood test. You could see in the slides that how a blood test is done. Students, it's a very simple way of taking the blood from your body. Now, a simple syringe pricks onto your finger and a sample is collected, and that is taken on the glass slide for the test. So, from that test it could be known what kind of disease do you have from the sample of your blood. Now, I have already told you that malaria spreads through female mosquitoes, Anopheles. They are known as Anopheles. The female mosquitoes are known as Anopheles. You could see how the pathologist checks the blood sample and tests it. So there is Dr. Mariam who is looking at the blood slide under the microscope. How is the blood sample tested? There are very minute, tiny disease carrying germs which cannot be seen, which are not visible through our eyes like that. So it needs an instrument. So here the blood sample is kept under the microscope, and the microscope could see tiny things in a bigger way. So it makes the things look 1,000 times bigger. So Dr. Mariam could see the minute details inside the blood, and she could know what is wrong with the blood. This is how a blood test is done. It is done in so many pathology laboratories. They are the special places where a blood testing is done in an effective way. Now let us move to the next part of the conversation. What happens then? Nancy asks, did they take the blood from the place where the mosquito had bitten you? Everyone is so curious to know that how did Rajat get malaria and how did the doctor know that the mosquito had bitten him in a particular place. So she is curious to know whether the doctor knew that where the mosquito had bitten Rajat, and was the blood taken from the particular part. Rajat was feeling so surprised. He says, of course not. How do I know when and where the mosquito bit me? It is not that easy to identify that when the mosquito bit him and where exactly the mosquito bit him. Now Nancy had a question. But how could they find out that you had malaria by your blood test? Do you think they could see something in the blood? Yes, definitely there was something which was detected in the blood of Rajat. Those were the disease carrying germs which identified malaria in Rajat's blood sample. And how do you know that you have malaria? Students, there are some symptoms. Some things happen with our body which help us to identify that there is something wrong going within our body. So whenever you have malaria, how do you identify you have got malaria? There are some symptoms. You get high fever with chills, like you keep shivering. Even if it is hot, then also you are chilling. So, chills with rigors. You could see very clearly there is a report of the blood test given there, and which words in the report help us to know that the person has malaria. Now it is written very clearly that malarial parasite found in the blood sample. So from the report it is very clearly evident that you have got malarial parasite in your blood sample. So that tells us, that is identified that in your blood sample there is the parasite for malaria, and so you are affected with malaria. So that is how you could know from a clinical pathology report very clearly that whether you are suffering from the disease or not. Now student, we should also know that what is the medicine for malaria. From very early times, the dried and powdered bark of the cinchona tree was used to make a medicine for malaria, and earlier people used to boil the bark powder and strain the water which was given to the patient. So this particular tree, cinchona tree, this is a very effective medicine for the patients who are suffering from malaria. The crushed powder is boiled and then it is strained. The water is strained, and that water with the medicinal effective qualities of the cinchona tree is given to the patient. Now the tablets are made from this and they are given to the patients. It's a very common medicine called quinine. Quinine is the medicine which is given for malaria. Okay, so we got to know the symptoms of malaria. We got to know how malaria is caused. The carrier is the female mosquito, female Anopheles mosquito, and what is the medicine for malaria. That is quinine, and in the earlier times that was cinchona tree. From the bark of the cinchona tree, the medicine was prepared and given to the patients, those who were suffering from malaria. So again the students are discussing about something else. Aarti says, you know, I also had to get a blood test done, but they took a syringe full of blood. The blood test showed that I had anemia. Now Aarti says she also went through a blood test like Rajat, but in her case they didn't take 2-3 drops of blood on a glass slide, rather they took a syringe full of blood. Maybe it was for a different purpose. We will get to know why the pathologist had taken a syringe full of blood from Aarti. Rajat didn't know anything about it, so he was curious to know. He asks, what is that? Aarti replies, she has the answer to Rajat's query. Aarti says, the doctor said that there is less hemoglobin or iron in the blood. The doctor gave some medicines to give me strength. He also said that I should eat jaggery, amla and more green leafy vegetables because these have iron. So here was the reason why a syringe full of blood was taken from Aarti, because she had another kind of disorder. This is a blood disorder. Anemia is a particular disorder of blood when you have less hemoglobin or iron in your blood content. So this occurs as anemia. This is loss of iron or hemoglobin in your blood. And to increase the iron in your blood, we have to take the food which is rich in iron content. What were those food which were suggested to Aarti to get rid of anemia, those food were jaggery, amla and more green leafy vegetables. So in that way she could get more iron in her blood. Nancy asks, how can there be iron in our blood? This is a very important question. Students, we should know that our blood contains so many essential nutrients. Out of that, iron is also in our blood. It helps us to get strength and immune to many other diseases. So, iron is also found in our blood. Jaskirat says there was something about this in the newspaper yesterday. So there was something in the news just before one day. Yesterday he has got some news related to the particular disease anemia. Rajat makes fun of it and asks, so then you ate iron or what? He was feeling very funny that our blood has iron in it and she had less iron in her blood. So, she had to take iron. Students, is it possible that a human being will eat iron to increase the iron content in the blood? No. But yes, we have to eat, we have to consume the food which is rich in iron content. Aarti says, silly, this is not the iron used to make these keys. I don't know exactly what it was. After I ate a lot of vegetables and whatever the doctor had said, my hemoglobin went up. So, Aarti had to eat a lot of jaggery, amla and so many green leafy vegetables which are rich in the iron content. Now there is a news clipping which is related to anemia, which Jaskirat was talking about. The news article read that anemia is common in Delhi school. This is a news clipping from 17th November 2007 in which it is mentioned that thousands of children studying in the municipal corporation schools in Delhi suffer from anemia. This is affecting both their physical as well as mental health. Due to anemia, children do not grow well and their energy levels are low. This also affects their ability to study properly. Now, health checkups are being done in the schools and health cards are being made for all the children. Anemic children are also being given iron tablets. So, this says that when you suffer from anemia, there is lack of iron in your blood. Hemoglobin level is low and the students who get affected with that cannot get mental strength to focus in their studies. It affects their mental strength also and physically also they become weak. Their energy levels go very low. They feel very tired, exhausted and so they cannot focus on their studies as well. So the schools took up an initiative to take care of the health of these students and there they were also given iron tablets in the school. So this way they got to control the anemia in the schools of Delhi. So students, I do believe that you have understood whatever we have learned so far, but there are so many interesting facts to know about malaria and even many other diseases. So students, we have understood everything very well, isn't it? But there are few questions which would decide that whether you have understood the chapter properly or not. Here is the first question for you. Do you know anyone who has had malaria? This is very simple and obvious that you would have heard someone from your neighborhood who had suffered. So yes, one of my friends or one of my neighbors once suffered from malaria. How did they find out that they had malaria? So this is very obvious. It's a very simple answer for you all. Yes, you are absolutely correct. It was found by the blood test, as it was found in the case of Rajat. Okay. Now we have a next question. What problems did they have on having malaria? What problems did they have on having malaria? So the problems they had were high fever, and the fever came with bouts of shivering. So my friend suffered from high fever and the fever came with bouts of shivering and he became very weak. So students, I do believe that you have understood whatever we have learned so far, but there are so many interesting facts to know about malaria and even many other diseases. So for that you should be patient and we will cover all those facts and aspects in the next session. Okay? So till then, bye bye and keep smiling and keep enjoying yourselves. Thank you.